Imagine this. You're sitting in a doctor's office. You've been having some pain, maybe in your back, maybe in your belly. The doctor looks you in the eye and says, "We need to operate." And just like that, a date is set. But here's what nobody told you. In a major study of community living older adults, overall 1-year mortality after major surgery was over 13%, and more than 1 in 4 who were frail and nearly 1 in 3 who had probable dementia died within just 1 year of going under the knife. That is a staggering number. And the worst part? Many of those surgeries could have been avoided, delayed, or replaced with safer alternatives. If you're over 65 or someone you love is, what I'm about to share might just save a life. Stay with me. This might be the most important video you watch this year. Hello, and welcome back to the channel. Today we're going to have a very important and very honest conversation about surgery after the age of 65. Now, I want to be clear right from the start. I am not saying that all surgery is bad. I'm not saying you should never agree to an operation. Modern medicine is incredible, and surgery saves countless lives every single day. But here's the truth that many people don't hear. In the United States, an estimated 4 million surgeries are performed each year on patients ages 65 or older, and unlike younger patients, older surgical patients are more likely to have age-related health factors such as cognitive impairment, hypertension, diabetes, and heart disease. That combination of advanced age plus chronic health conditions creates a very different risk equation than what a 40-year-old faces. With each passing year after age 65, older adults are increasingly vulnerable to complications and readmission after surgery. Many have multiple chronic conditions, including diabetes, high blood pressure, and arthritis, and may have depression or dementia. Some take lots of medicines that cause side effects. So today, we're going to talk about 5 specific surgeries that carry significantly higher risks for people over 65. These are procedures where you absolutely must ask tough questions, explore every alternative, and make sure you are fully informed before you ever agree to go under that scalpel. Let's get into it. Number 1, and this is the one that catches people off guard the most, is emergency exploratory laparotomy. Now, that's a big medical term, so let me break it down. An exploratory laparotomy is when a surgeon opens up your entire abdomen, a large incision from top to bottom, to look inside and figure out what's going wrong. It's often done in emergency situations when doctors aren't sure exactly what's happening. Maybe there's internal bleeding, a bowel obstruction, or a ruptured organ. Now, here's the problem. Exploratory laparotomy had the highest proportion of death in almost every age category studied. And when you combine the emergency nature of this surgery with the fact that you're over 65, the risks go up dramatically. High-risk emergency procedures resulted in an 8-fold increase in the odds of death following surgery. Let me say that again, 8 times more likely to die, and that's compared to lower-risk procedures. Non-frail patients undergoing high-risk emergency surgical procedures had a 7.1% mortality rate, while frail and severely frail patients undergoing those same high-risk procedures had mortality rates of 11.5% and 25.8% respectively. 1 in 4 severely frail older adults did not survive. Now, I know what you're thinking, but if it's an emergency, I don't have a choice. And sometimes, that's true. But here's the critical message from researchers. Elderly patients should undergo surgical treatment when they first present with their disease. It should not be put off until complications develop to the point where an emergency operation is needed, because that emergency operation is the most significant risk for mortality and complications. In simple terms, don't ignore the warning signs. If your doctor says you have gallstones or a hernia or a bowel issue, don't keep putting it off thinking, "I'll deal with it later," because later can turn into an emergency, and emergencies are far more dangerous. Think about it like maintaining your car. You change the oil regularly to prevent the engine from failing. Your body works the same way. Take care of the small problems before they become life-threatening ones. Number 2, open heart surgery, specifically coronary artery bypass grafting, or what most people call a bypass. This is one of the most common major surgeries for older adults in America. The surgeon opens your chest, stops your heart temporarily, and reroutes blood flow around blocked arteries. Now, open heart surgery has saved millions of lives, but for seniors, particularly those over 75 or 80 with other health conditions, this surgery carries serious risks. Research shows that a 30-minute increment of operative duration increased the odds of mortality by 17% in patients older than 80 years, and post-operative morbidity and mortality increased progressively with increasing age. Open heart surgery typically lasts 4 to 6 hours. You do the math. After surgery, elderly people have more difficulty maintaining homeostasis, which is a physiological state of equilibrium, and suffer more readily than younger patients from hypothermia, low blood sugar, and anemia. Additionally, they're more likely to fall. And there's another risk that many families don't think about. Postoperative delirium is one of the most common complications after surgery in older adults. It's a temporary condition in which the patient is confused, disoriented, and unaware of their surroundings, with problems with memory and paying attention. It may not start until a few days after surgery, may come and go, and usually disappears after about a week. But for some seniors, it doesn't just disappear. Postoperative cognitive dysfunction, or POCD, is a more serious condition that can lead to long-term memory loss and make it difficult to learn, concentrate, and think. Conditions including heart disease, especially congestive heart failure, lung disease, Alzheimer's disease, Parkinson's disease, and a history of stroke all increase your risk. So what can you do? Before agreeing to open heart surgery, ask your cardiologist about less invasive options. Today, there are procedures like stenting, catheter-based valve replacements, and minimally invasive bypass techniques that may achieve similar results without cracking open your chest. Ask these questions. Is there a less invasive alternative? What happens if I choose not to have this surgery? What is my realistic life expectancy with and without this procedure? A good doctor will welcome those questions. If your doctor dismisses your concerns, consider getting a second opinion. It could save your life. Number 3, extensive multi-level spinal fusion surgery. Now, back pain is something almost every person over 65 deals with at some point. It's one of the most common complaints I hear about. And when physical therapy, medications, and injections stop working, a surgeon may suggest spinal fusion, a procedure where 2 or more vertebrae are permanently connected to eliminate movement between them. For younger, healthier patients, spinal fusion can be very effective, but for seniors, especially multi-level fusions, where the surgeon fuses 3, 4, 5, or even more vertebrae, the risks increase significantly. The incidence of spinal surgery, including instrumented fusions, is increasing and progressively involves patients age 65 and older. Older patients, however, frequently harbor multiple overlapping health conditions that increase their susceptibility to the major risks and complications associated with spinal surgery, particularly when involving extensive instrumented fusions. And here's something truly alarming. Sometimes geriatric patients are scheduled by surgeons for spinal operations they do not need, and sometimes geriatric patients are subjected to too much surgery consisting of multi-level instrumented fusions. In one study, unnecessary spinal surgery was recommended for over 17% of patients seen in consultation, and out of 47 patients over age 65, 7 with 19 health conditions were scheduled for unnecessary operations, with 5 of 7 involving multiple levels. Extensive instrumented spinal fusions, increasingly being performed in patients 65 and older, result in higher morbidity and mortality rates. Let that sink in. Nearly 1 in 5 patients were being told they needed surgery when they actually didn't. Instrumented spinal fusion in elderly patients has been called into question due to the risk of age, screw loosening, and other health conditions. Osteoporosis, or thinning of the bones, represents a major consideration before performing spine surgery. Many seniors have thinning bones, which means those metal screws and rods may not even hold properly. Increasing age was still an independent risk factor for major postoperative complications in elderly patients undergoing lumbar spinal fusion surgery, and for patients at 80 or 81 years old, the incidence of major complications was tenfold higher than for those at 77 years old. So what's the alternative? One of the key advancements in spine surgery is the development of minimally invasive techniques. Unlike traditional open surgery that requires large incisions and significant muscle disruption, minimally invasive spine surgery uses specialized instruments and techniques to access the spine through small incisions. There's also decompression surgery, which can relieve nerve pressure without the need for a full fusion. If you're over 65 and a surgeon recommends a multi-level spinal fusion, please, I'm asking you from the bottom of my heart, get a second opinion. Try physical therapy, ask about injections, explore every possible option before committing to a major fusion operation. Your quality of life depends on it. Now, before we get to number 4, I want to pause here for a moment. If you're over 60 or caring for an elderly loved one, this information could be life-saving. Please take a moment right now and hit that subscribe button. Share this video with your family, your children, your spouse, your friends, because knowledge is the most powerful tool we have when it comes to protecting our health. And if anything in this video has hit close to home, leave a comment below. I read every single one. Let's look out for each other. All right, let's continue. Number 4, the Whipple procedure. This is one of the most complex surgeries in all of medicine. Named after Dr. Alan Whipple, who first performed it in the 1930s, this procedure is primarily used to treat pancreatic cancer. The Whipple procedure involves the removal of portions of several organs and takes 5 to 8 hours to perform. During this marathon surgery, the surgeon removes the head of the pancreas, part of the small intestine, the gallbladder, and part of the bile duct, then reconstructs the entire digestive tract. Now, the Whipple procedure is complicated and it carries a risk of death, especially if an inexperienced surgeon carries it out or it takes place in a hospital that rarely performs this surgery. Approximately 2% of people who undergo the Whipple procedure will die as a direct result of the surgery. That's the overall average for all ages. For seniors, the picture gets worse. The older adult group had higher rates of cancer diagnosis, diabetes, congestive heart failure, and hypertension, and they also had higher rates of postoperative mortality, pneumonia, transfusions, and delayed gastric emptying compared to the younger group. Researchers found higher rates of mortality and postoperative heart attacks among older adults after Whipple procedures, and for those over 80, the picture is even more sobering. Analysis showed that patient age 80 years or older was associated with postoperative mortality independent of the tumor type and surgical technique, with an odds ratio of 6.71. That means patients over 80 were nearly 7 times more likely to die after pancreatic surgery compared to younger patients. Between 30 to 40% of people who undergo the procedure experience at least one complication. So what should you do if you or a loved one is facing pancreatic cancer and the Whipple procedure is recommended? First, candidates for a Whipple procedure should visit an experienced surgeon who carries out at least 15 to 20 Whipple procedures every year. This is not the kind of surgery you want performed by someone who does it once or twice a year. Second, have an honest conversation with your doctor about your overall health. Consider your heart health, kidney function, lung capacity, and nutritional status. Rather than focusing on age alone, it is more important to consider the patient's overall fitness level and existing health conditions and base the decision on a careful individual risk-benefit analysis. Third, ask about the realistic expected outcome. Will this surgery give you more quality years, or will the recovery itself steal away the time you have left? These are hard questions, but they are necessary ones. Number 5, emergency bowel resection surgery. This includes procedures like open colectomy and small bowel resection. These surgeries involve removing a damaged or diseased section of your large or small intestine, and are often done when there's a bowel obstruction, perforation, severe infection, or advanced colon cancer that has caused a crisis. High-risk procedures identified by researchers included open cholecystectomy, open colectomy, laparoscopic colectomy, small bowel resection, and perforated ulcer repair. And here are the numbers that everyone over 65 needs to understand. Non-frail patients undergoing high-risk emergency surgical procedures had a 7.1% mortality rate, while frail and severely frail patients undergoing those same high-risk procedures had mortality rates of 11.5% and 25.8% respectively. Emergency and major gastrointestinal operations were associated with a significant increase in mortality. Patients aged over 90 undergoing emergency major colonic or upper gastrointestinal surgery had a 90-day mortality rate of 53.8%. More than half did not survive 3 months. That is a devastating number. After emergency abdominal surgery in patients in their 80s, 30-day mortality was 29%, yet only 7.5% after elective procedures. Do you see the pattern? Emergency surgery is 4 times more deadly than planned surgery. So what's the takeaway? If you've been diagnosed with colon polyps, diverticulitis, a hernia, or any gastrointestinal issue, please don't ignore it. Don't say, "Oh, I'll deal with it next year." Because what starts as a manageable condition can become an emergency that requires exactly the kind of high-risk surgery we're talking about. Research showed that 1 in 3 older adults had not returned to their baseline level of functioning 6 months after major surgery. Most likely to recover were seniors who had elective surgeries for which they could prepare in advance. That's the golden rule. Planned surgery you prepare for, gives you the best chance. Emergency surgery is where the danger multiplies. If you get regular colonoscopies, follow your doctor's recommendations for monitoring gastrointestinal problems, and address issues early, you can potentially avoid ever needing one of these emergency operations. Now, I know I've shared some scary statistics today, but I don't want you to walk away feeling afraid. I want you to walk away feeling empowered, because knowledge gives you the power to make better decisions. Here are my top practical tips for anyone over 65 who may be facing surgery. Tip number 1, always get a second opinion, especially for any major procedure. Most older adults can go through surgery well, but no one should take the decision lightly. A second opinion isn't a sign of distrust, it's a sign of wisdom. Tip number 2, ask about alternatives. With advances in medicine, many conditions that once required open surgery can now be treated with minimally invasive procedures, medications, physical therapy, or even watchful waiting. Tip number 3, prepare your body. To help prepare for future surgery, doctors recommend physical therapy and eating more high-protein foods, measures that help patients get stronger. Some patients may need 6 to 8 weeks to get ready for surgery. This concept is called prehabilitation, and it can dramatically improve your outcomes. Tip number 4, bring someone with you to every appointment. It's a good idea to have someone with you during meetings with your medical team, preferably a close family member or friend. This person could tell the doctor something you forgot to mention and might have helpful observations about your health. Tip number 5, ask about your anesthesia risk specifically. Older patients generally face increased risks from anesthesia during surgery because of their age-related decline in physiological function, which significantly alters their ability to metabolize and respond to the drugs. Ask your anesthesiologist what steps they'll take to minimize your risk. Tip number 6, prepare your home for recovery. Although most people prefer to recuperate at home, many homes aren't set up to accommodate elderly patients' needs safely. Patients come home still very weak, and family members taking on the caregiver role aren't always prepared, especially when there are stairs and bathroom issues. Think about these things before surgery, not after. Let me wrap this up with a message from my heart to yours. Growing older is one of life's greatest privileges. You've worked hard, raised families, built communities, and earned the right to enjoy your golden years. And protecting your health is the most important thing you can do to keep enjoying them. Today we talked about 5 surgeries that carry significantly higher risks for people over 65. Emergency exploratory laparotomy, open heart surgery, extensive multi-level spinal fusion, the Whipple procedure, and emergency bowel resection surgery. We're not saying never have these surgeries. We are saying never agree blindly. Always ask questions. Always explore alternatives. Always get a second opinion. And most importantly, don't wait until small problems become emergencies, because elderly patients should undergo surgical treatment when they first present with their disease. It should not be put off until complications develop to the point where an emergency operation is needed, because that emergency operation is the most significant risk for mortality and complications. You deserve to make informed decisions about your body. You deserve a doctor who takes the time to explain everything, and you deserve to live your remaining years with the highest possible quality of life. If this video helped you, I need your help too. Hit that subscribe button so you never miss important health information like this. Share this video with someone you love, a parent, a spouse, a neighbor, a friend. You never know, this video might reach someone at the exact moment they need it most. And please, leave me a comment below. Tell me, has anyone in your family faced a difficult surgery decision? What would you like me to cover next? I read every comment, and your stories help me create content that truly matters. Thank you for watching. Take care of yourselves, take care of each other, and I'll see you in the next video. Stay healthy, my friends. This video is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before making any decisions about your health or medical procedures.